children have a different tolerance level as adults. So we need to go to a pediatrician. It is advised कि आप घर का खाना खाओ, ज़्यादा heavy मत खाओ, and ये जो काढ़े वगैरह है, these really help along with your allopathic medicines. There is no intermixing or no side effects. Breathlessness as at rest is one symptom which we should be wary of. If the child is breathless or if the adult is feeling breathless, is not able to speak full sentences at sitting position, that is one center where he needs to go to a
नमस्कार, India.com और हेल्थ साइट में आप सभी का स्वागत है। तो देश विदेश में कोरोना वायरस का नया वेरिएंट ओमाइक्रॉन जो है वो हाहाकार मचा रहा है। भारत में ही हर रोज इस वेरिएंट के केसेस जो हैं वो बढ़ते ही जा रहे हैं। वहीं इस वेरिएंट को लेकर कई सारी अटकलें, कई सारी खबरें हर रोज आ रही हैं। So doctor, my first question to you is that we all know what Omicron is. It's come into India and we see a rise in the cases every day. So doctor, the symptoms of this variant are very similar to flu. So shall we take this variant very seriously? Because recently a lot of children are getting affected with Omicron. So
Yes.
why is that so? And also doctor, what are the symptoms that we're seeing in children? Is it different from the adults that we see in the children?
The Indian Academy of Pediatrics has classified Omicron not as a variant but as a deviant. Now it means that it has deviated from its normal structure. So in our first and second wave, we did not see many of pediatric cases. Okay, and almost all, we have treated around 250 pediatric cases in the first and second wave, but none of them had pneumonia. But in the third wave, we are seeing that substantial number of pediatric cases have X-ray symptoms or have pneumonia. Now this is a problem. The symptoms are different from the second wave. But here, the symptoms in pediatric cases are similar to adults. Here we are seeing many cases in children who have symptoms similar to adults. But the recovery rate is also very high. We are seeing very few deaths in adults, but the deaths in children are almost negligible.
So doctor, can you highlight the
zero.
symptoms that we're seeing in children these days in this data that you mentioned?
Similar. We are having symptoms of cough, cold, fever, coryza. Children are coming up with pneumonia. Okay, these are the symptoms. I have not seen a child with breathlessness, but cough, cold, fever are the commonest symptoms that we are seeing in children.
As you mentioned the symptoms, so is there a treatment for children different from the adults? What is the line of treatment exactly?
The line of treatment is similar, madam. The only thing is children have a different tolerance level as adults. So we need to go to a pediatrician who will, what happens is the level at which we see that this adult is serious and the level at which we say that a child is serious are different.
Right.
Children get serious very fast. So we need to go to a pediatrician. He will prescribe proper, secondary antibiotics to prevent an infection, antipyretics, antihistaminics, and if required, antivirals. Treatment is similar.
Right, doctor. So another thing that we see in Indian households that हम लोग घरेलू नुस्खे जो हैं उसको बहुत ज्यादा यूज करने लगते हैं. Especially we saw the usage of kadha and a lot of things came in. So what would be the diet, especially for children, if you have Omicron or something? What line of things should be taken
care of? What happens is, in this kind of fever, we advise light diet. Okay, there is no need for any special diet, but एकदम heavy तेल वाला ये खाना that is not recommended. जो भी घरेलू खाना है, madam, Indian घर का खाना is really healthy and is made for throughout our ages. Good old people or wise people have made Indian घर का खाना so good that घर का खाना खा के we stay healthy. So it is advised कि आप घर का खाना खाओ, ज़्यादा heavy मत खाओ, and ये जो काढ़े वगैरह है, these really help along with your allopathic medicines. There is no intermixing or no side effects. What I will advise is people who are on home isolation, adults or children, should buy a SpO2 monitor, that is the pulse oximeter. Handheld pulse oximeter 800 या 1000 रुपए में आता है, रख लो and just get your pulse reading every 3 hours or 4 hours. हर 4 घंटे में अपना ऑक्सीजन लेवल देखा करो. If your oxygen level does not go below 95, there is nothing to panic.
Right.
If it goes below 95, if it goes below 93, See, once or twice it may go below 93. Yeah, एक 15 मिनट के लिए it may go below 93. Still it is no reason for panic. But अगर आपका 2 घंटे के लिए 93 से नीचे जा रहा है, immediately consult your doctor. He'll advise you कि आपको hospital जाना है, X-ray.
Right, doctor. My next question to you was same, that in this Omicron situation, because the symptoms are very common to flu, तो हमें कब समझ में आएगा कि okay, now we need to rush to the hospital and the condition is worsening. So what is that particular situation, if you can explain?
Yes. The cutoff point for that SpO2 or the pulse oximetry is 93% given. But I advise कि आप 95 पे रखो. Because you need to, कभी कभार मेरा रात को 93 गया, then there is no point in rushing. So I advise people कि आप 95 पे रखो. 95 से नीचे अगर मेरा SpO2 जाता है, वो अपने घर पर ही रहता है. Have your SpO2 measured every 4 hours. और 95 से नीचे अगर आपका SpO2 जाता है, consult your doctor.
Right, doctor.
Till then, there is one more thing. अगर बहुत सारा कफ हो रहा है, बहुत सारा fever हो रहा है, high grade fever, then you can go to your doctor. See, once you get positive, the local municipal corporation or the local health authority comes to your house. They give you your medications. They have a full surveillance system. In Thane, we have a full surveillance system. Every day, जो भी total number of cases who are detected positive, they come, they are, brought to the notice of the headquarters and they are distributed to the health post. And people from the health post go to the house of the people, okay, and give them a kit. कि भाई ये आपका medication का kit है. And every day a phone call goes to them. कि भाई आप ठीक हो आज आपकी क्या position है? We are also planning another thing which will get activated in another 2-3 days. That is, we are planning a Zoom meeting. Every patient, every person, every doctor will उसके जो area में जो patients है,
telemedicine if I can call.
Yeah, on home isolation, contact them by Zoom. कि भाई आप कैसे हो? आपका SpO2 कितना है? अभी measure करके दिखाओ मुझे. And that will happen once or twice a day. और आपके घर में अगर वो SpO2 monitor है, get it done every 4 hours. आपका अगर 95 से नीचे जाता है, inform your doctor. अगर 95 से ऊपर है, you are safe. And अगर आपको fever वगैरह कुछ है, then you can always contact your doctor. Yeah, breathlessness. Breathlessness as at rest is one symptom which we should be wary of. If the child is breathless or if the adult is feeling breathless, is not able to speak full sentences at sitting position, that is one symptom where he needs to go to a doctor.
Right, doctor, that was it. Thank you so much for connecting with us and telling our viewers of India.com and the health site and making them aware of this new variant, Omicron.
Thank you. Thank you very much, ma'am.